Hello and welcome back to the channel. Today we're going to be continuing on with our series on surgical and non-surgical options that people have to improve the way that they look. And in this particular video we're going to be talking about something that most of you probably know about this, botulinum toxin or Botox, and we're going to be covering a number of myths and realities that surround Botox use. When you're young, your skin stays smooth and supple. But this is going to change as you get older. The skin will lose its elasticity with age, becoming more wrinkled, less supple, and developing more spots and irregularities. We've covered the factors that influence how your skin ages from both a genetic perspective, from a sun damage perspective, from a environmental factor perspective. All three of those videos have already been made on the channel, so I recommend that you go to those first to understand why your skin will even become less supple and less smooth. On this series, we've talked about dermal fillers and, more importantly, hyaluronidase, which is the enzyme that's used to break down dermal fillers when you don't want it anymore. And so another option for reducing wrinkles, much like dermal fillers, is botulinum toxin. The botulinum toxin that makes up Botox is a toxin that's derived from a bacteria called Clostridium botulinum. It is a highly toxic substance that stops the release of the neurotransmitter acetylcholine from nerve endings in nerve and muscle junctions. There are mainly 7 botulinum neurotoxin. These are types A, B, C, C1 and C2, D, E, F and G. Human botulism, you know, that disease that you get from eating rancid 10-day-old meat that you shouldn't have eaten and it gets you very sick, well, that's caused by types A, B and E and sometimes by F. It's not the same as the one that you're injecting into your skin. Some of the botulinum types do have cosmetic and medicinal value, with the most commonly used one, botulinum toxin A, being used in the application of botulinum toxin in an injectable form, which is a common method used in relieving stress lines on the face and reducing wrinkles. As a person ages, the skin starts to lose its elasticity, leading to these wrinkles, and so botulinum toxin works by blocking signals from nerve endings to muscles and making them unable to contract. Basically, telling your muscles to relax. As you can then imagine, a relaxed muscle allows the peaks and valleys of a wrinkle to smoothen out. Botulinum toxin or Botox has been gaining enough popularity over the last few decades, with better and more safe procedures and methods being developed for using it. It has been extensively studied and has been approved for treatment for multiple conditions, not just for cosmetic reasons. However, there are still some misunderstandings and myths that we should probably talk about to iron out the issues. Myth number 1, botulinum toxin injections are, well, toxic and dangerous. While botulinum toxin in its pure form is extremely dangerous, the ones used for medicinal and aesthetic purposes are very much safe to use. These injectable forms are proteins derived from the bacteria that produce the toxin, not the bacteria itself. These are then chemically tested and approved by the FDA for different uses, and you may have different opinions on this, but I very much trust the FDA and TGA, which is the Australian equivalent, judgments on different medicinal uses, because they may not be perfect, but they are very thorough in their procedure. However, like any medication, botulinum toxin injections also have some side effects. These include bruising, pain at the injection sites, headaches, excess flaccidity of the muscles, and quite rarely hypersensitivity reactions to the substance itself. Myth number 2, botulinum toxin causes the frozen face effect. There is a belief that using Botox can cause the freezing of the muscles of facial expressions, leading to an inexpressive face, one where you're unable to make any movements because the muscle just is permanently relaxed. This, however, is usually because of an overdose, not by an actual standard dose of Botox. If done by an experienced doctor who knows the exact amount of this substance to inject, there are very few chances of this happening in reality. So it is always good to get this done by an experienced personnel, not by your friend who got this off the black market in your dad's garage. Myth number 3, Botox can get rid of all wrinkles. There are mainly 2 kinds of wrinkles. There's dynamic and static. Dynamic ones are made with facial movement, like your nasolabial lines or your smile lines, and these include your frown lines, crow's feet laughs, laugh lines, forehead wrinkles, so on and so forth. These wrinkles appear with facial expression and then disappear when you're going back to normal. It's only really a problem if they don't disappear when you're neutral again. The static wrinkles are present at rest and deepen with age. These include the corners of the mouth, over the cheeks, along the neck, and with age they will deepen as the collagen levels of the skin decrease, decreasing the elasticity, and dynamic wrinkles will start to become static wrinkles. While botulinum toxin injections can treat both types of wrinkles, the static ones may need other treatments as well, such as fillers, to actually make up for the volume loss that occurs with age, such as the tendons actually responsible for holding the muscles together starting to weaken, the facial muscles themselves starting to weaken, or an overall loss in much needed facial fat. Not the excess facial fat that makes you look round and chubby, but the much needed one that makes you look not like a skeleton. Botulinum toxin injections can decrease the frown lines around the glabella, crow's feet at the side of the eyes, forehead creases, wrinkles around the mouth, nasolabial folds or smile lines, and smoothing out the wrinkles of the neck, chest, and cleavage. Myth number 4, botulinum toxin is only used to treat wrinkles. Botulinum toxins, or Botox, has multiple uses. It is generally commonly used in decreasing the number of wrinkles, but it can also be used to elevate the eyebrows, treat skin problems like lichen simplex or ponfolix, and acne. It has also been approved for use in the treatment of laryngeal dystonia, strabismus, blepharospasms, neurodetrustor overactivity, chronic migraines, and upper limb spasticity. So a number of uses that are not directly related to skin appearance or aesthetics, but rather to calming down overactive muscles. Myth number 5, botulinum toxin injections are painful. With the proper application of local anesthetic, botulinum toxin injections are not painful, but even with no numbing agent, the pain is still quite minimal because it's just a needle. If you're scared of needles, then obviously it's very painful. If you're not, it's not very painful at all. The procedure is quick and under the hands of trained personnel. You can finish before you even realize that the injection has actually gone through. Studies are underway to reduce even the minimal pain of injecting this agent with the help of other drugs such as nitrous oxide. As they say, however, beauty is pain. Myth number 6, the effects of botulinum toxin are permanent. The effects of Botox is only going to last for about 3 to 4 months. Following this period, the muscles will start regaining their strength and the wrinkles may just reappear. Botulinum toxin takes about 24 hours to start working after being injected, with maximum effects being seen up to 1 to 4 weeks. Again, after the effects wear off, re-injecting the toxin is necessary to lessen the wrinkles once again. Myth number 7, botulinum toxin can cause addiction. Botox is not physically addictive and won't cause dependence. However, in some cases, the person may become too used to the effects of Botox, or the Kim Kardashian effect, and this may cause them to get the treatment repeatedly, which is a much bigger issue in the medical community and is more of a problem of body dysmorphia, as we've covered in our videos on Zoom dysmorphia and Snapchat dysmorphia, where extrinsic factors such as the rise of social media and the rise of glamorizing one's life on social media, with the rise of filters and Photoshop being more prevalent, these are actual factors that can contribute to making Botox an addictive procedure, but the substance itself is not addictive. Myth number 8, botulinum toxins affect the whole body. Botox injections only affect the muscle where it is injected. Its effects are limited to only one muscle or muscular group, and hence they can't really spread to other parts of the body. With this video, hopefully your idea of what Botox is, how it works, and some of the myths surrounding it are a bit less obscured, and you can better understand how this can actually play into a role in your preventative care for later down the track as people naturally do age. Now, Botox itself isn't a be-all and end-all solution. I've always said that prevention is the best cure, especially when it comes to skincare, and oftentimes what we've seen in the medical literature from maybe 100 or so videos now, is that prevention in the form of skincare, such as sunscreen, and sun avoidance techniques such as covering up when you're going out for long periods of time, are the best solutions to avoiding wrinkles, rather than relying on bad lifestyle choices such as smoking and drinking excessively and not wearing sunscreen obviously, and then hoping you can somehow afford or fund your extensive surgeries down the line for making yourself look better, both surgical and non-invasive, in the form of Botox or dermal fillers.